Kids are mischievous, and so young children frequently swallow objects, take them into their mouths, choke. So there's a gamut of signs and symptoms. And so swallowing an object and the care required really depends on a number of things. The nature of the substance. Was it plastic? Was it glass? Was it a battery? Was it a coin? Because the treatment for some of those varies. So for instance, if a child swallows a battery, that's a medical emergency because the battery can actually erode through the esophagus. We see a number of patients who swallow plastic and suck it into their lungs. In other words, they suck it down their airway or their trachea, and that likewise is a medical emergency because it has to be removed. The other entity that we see is the parent who says, my child was playing in a room and there were toys around, there were various things around, and I heard him choke. And when I came in, they were choking and drooling, so I don't know if they swallowed something and spit it out because I couldn't find anything or if it's still there. Those are the ones that become somewhat more challenging for us because X-rays can sometimes show an object if it's metal and some forms of glass, but if it's plastic or rubber, that foreign body can be somewhere in the intestines, let's say, and be non-visible on an X-ray. That's where we have to use some decision making to decide, will it pass or do we need to perform any kind of intervention? So it goes like this. If we think the child sucks something into their lungs, the child undergoes what's called bronchoscopy. A scope gets placed into the windpipe, and literally the surgeon has to look inside the airways of the lungs to see if there's an object. Sometimes they find something and sometimes they don't. Most objects that are swallowed and end up in the esophagus or food pipe typically travel through. And interestingly enough, glass usually flows through or comes out the other end easily. Small parts, coins, even stick pins usually pass through very easily. So although a child swallowing an object is somewhat scary to the parent, if it goes through the esophagus, it's not usually much of a problem. The issue is deciding, does the child have an object in their lungs or in the supporting airway structures to the lungs, and that becomes a more significant medical emergency.